injection and the aspiration, which could include age, medications, other conditions. And the older we get, the less of these progenitor stem cells we have. And so a 20-year-old aspiration is certainly not the same as a 60-year-old aspiration. And depending on where that needle randomly goes, you may get a good pocket of blood, or something that's basically just peripheral blood, which you could have drawn out of a vein in a much less painful way.
Are there people, are people, or are there services where maybe people are being preventative, maybe they're a professional athlete, or they're in a competitive atmosphere, and are they doing anything like prophylactic, which is preventative, to maybe draw those good cells now, like Tua just got drafted, right? And that guy was like broke every year. Like he would play like 3/4 of the season and knee out, ankle out. Like he, whoever ends up with him eventually, it's like, oh, he has so many injuries. Are they doing like maybe prophylactic extractions now to help people like in the future, or like even for professional, I would imagine even for professional football players, hey, maybe we should draw these bios now while you have a greater, opportunity than 10 years when you're in pain and you have less opportunity for these progenitors.
Well, I think there's some challenges there with where you're going to store these cells, and there's a lot of regulations out there.
Air-cooled self-storage?
There's a lot of regulations that prevent manipulation of the cells. And so one of the keys that we really live by is if you're taking something out, say bone marrow or peripheral blood, then that needs to rapidly get back in to the patient.
Okay.
Whether it's their hip or their knee or their rotator cuff or their tennis elbow. And so you hear about this terminology of minimal manipulation, and we are essentially just pulling these elements and separating them with a centrifuge and then re-injecting the good stuff. And what we found is with the bone marrow is it's a big variability of, is this really stem cells, or is it essentially just a really robust peripheral blood draw that's quite painful? So that's kind of led to the next iteration of biologic injections, which is something called an amniotic suspension allograft. So that's a mouthful.
Is there a shortened term? Maybe give us a little
an acronym
for that.
ASA for amniotic suspension allograft. Essentially, you get a volunteer, which is a healthy female, that's going to be giving a elective C-section. They're not paid for it, but they agree to donate their tissues. And the amniotic fluid that's in the amniotic sac is harvested along with some elements of the amniotic membrane. And then that fluid, which includes cells, includes some scaffolding or extracellular matrix, which is part of the membrane, and the growth factors, which is what we said the majority of PRP is growth factors. So the ASA has three components: cells, scaffolding, and the growth factors. And then this is tested and packaged, and this ASA can then be injected. It's a very powerful medication because you don't have to go under anesthesia to get your blood harvested. B, you're getting more than just growth factors. And C, the ease of taking something out of the freezer, thawing it and injecting it is a lot easier than having to go through the process of a blood draw and a centrifuge or anesthesia.
So getting into the weeds, you talked about the other biologicals. Is the ASA not covered by insurance either?
That's correct.
Oh, so I'm sure that's the cheaper of the one, since it's so nice. So
along these lines, is this the reason why a lot of people are leaving the country to get that done?
So I think historically, there's certainly some famous sports figures that we know about, but historically, the regulations around manipulation of cells is what led people either to the Caribbean or Europe to have biologic treatments on their joints or on their tendons. And while the United States has kind of been recently the Wild West when it comes to regenerative medicine or biologics, and everyone's kind of hanging their hat on, I have stem cells or come here for stem cells. I think we've been very conservative in our explanation that this is a biologic treatment. We're not trying to say that stem cells, but we want to give you an option for treating your condition without surgery. And as these types of injections get studied more and more, and it starts showing that it's more effective than, say, a steroid injection or a gel injection for knee arthritis, for example, then that gives more value to the opportunity to use it. And this ASA injection that I'm talking about is actually one of the first that had a randomized controlled trial, peer-reviewed, that showed that it was more effective than placebo and steroid and gel injections.
And quick question, so for the ASA injection, is it based off of your blood type? How is that categorized? Or is it just maybe from someone you know, or someone, you said it was from a volunteer that had a voluntary C-section. So how is that donor identified with a possible patient?
So it's not similar to like a kidney transplant or a heart transplant. It's more akin to somebody who's having an ACL and they use a cadaver graft to rebuild their ACL.
Yeah.
And so the cells that are used and the tissue that's used, it's washed and tested for any pathogens, but it doesn't create that rejection response that, say, a living organism like a kidney or a heart would.
Okay.
And so it's a very, very benign treatment. And like I said, when you compare it to having a trocar stuck in your pelvis, just having an injection where you already hurt is a lot easier. And now we're starting to get some literature that's backing it up and saying, hey, this really does work. And we just helped that person avoid surgery. We just had a guy come in on last Tuesday, and a year ago to the week, he had this ASA injection for knee arthritis, and he was a little bit leery of whether it would work, but he'd had the gel injections, he'd had steroid injections, he hadn't had a lot of relief from them. He didn't have bad enough arthritis to want a knee replacement, so he was kind of in this no man's land where what he would say is, my knee still hurts and I need an option, but I don't want surgery. So we did this injection, and he just came in at his 1 year mark and he said, man, it's just starting to wear off. I want that injection again. And so
so it wears off. It doesn't, your body doesn't like, hey, kick in, hey, we need to regenerate that fully. So it's not like sci-fi. It's not like Star Trek, is what you're saying. Not quite.
It depends on the tissues, right? So if you're talking about knee arthritis, an injection is not going to make the bone spurs go away. You still have arthritis, but it's going to affect the environments of the knee, whether it be anti-inflammatory or in a microenvironment, you're getting some curing potential. But if you're talking about, say, a tendon, and you inject a tendon that is damaged, you might get enough healing to that tissue that problem goes away, and you never have to have it treated again. And so that was like the elbow example that I gave, where he had his PRP injections 2 years ago. He hadn't thought about his elbow since. And so there's certainly there is the role of, this problem is gone forever versus a maintenance. I want to provide something that will give me pain relief, and if I have to get a shot once every year, that's not a big deal. It's a lot better than surgery.
Yeah, absolutely. So for someone, say a 45-year-old runner comes in, his knees are...
He's asking for a friend again.
Yeah, and his knees are, painful, and you give an injection. What do you suggest to him to continue? Can he continue running? Can he continue acting the same way? Because obviously people want to feel better, but they also want to continue their lifestyle. And in sports medicine, they want to keep playing or they want to keep going. So what kind of advice do you give someone that, say, has had that injection to make that last that full year, but still want to run a marathon, still want to be active, still want to be out there?
I think that's a great point, and that's one of the reasons that I love sports medicine, and one of the reasons I went into this field is that I like to stay active and be involved, whether it's sports or fitness, and I want my patients to have that same satisfaction of getting back to the level that they desire. And so our goal is to help them reach that goal, but there are circumstances where we have to give a little bit of guidance as to cross-training, or mixing up what kind of forces or impact you're putting on that body part so that you can stay active. And we may have a patient who likes to run 7 days a week, but they really love to run.
Mm-hmm.
And so figuring out, A, let's get them better, and then B, how can we get you to keep running and also make you have some longevity. And so that means you might cross-train, and maybe you're only running 3 times a week, but you're still staying active. Ultimately, our goal is to get people back as high a level as they want. But what you're kind of asking, I think there are situations where the condition of your joint or your tendon may require us to make some slight modifications so that you don't ultimately get to the point where you have to have a surgery.
So same question, but a little bit different. Someone who, like myself, I love being active. I fell in love with running only about a year ago. I love to lift at the gym. I haven't had any pains or any discomfort. How do I keep that going? You seem like a wonderful person, but I really don't want to come to your office and visit and talk about injections and surgeries and stuff. I just want to just keep going.
Although I would say he's a good candidate for the hip trocar. That's his flavor.
But how does a guy in the mid-40s continue on to be healthy, be active, and stay out of your office? In a nice kind of way.
No, I'm not. I want to stay out of my office too. I think the important thing is taking care of your body, and this starts from an early age, and we're in an epidemic of times where we encourage our kids to subspecialize in one sport at the age of 6, and that is clearly proven to be damaging for kids, and can really cause a lot of chronic overuse injuries that affect them and cause them to burn out because they get hurt at a young age. And so that same principle applies across the board. Is you want to be able to cross-train, have your body and your muscles do different things so that you're not as high of a risk for those chronic overuse stress fractures or tendonitis issues. And so I think A, making sure you have good form, and B, staying in shape. We talk about how much pressure goes across the hip. When you're running or jumping, 6 to 8 times body weight goes across the hip as pressure.
Wow.
And so, simple math, if somebody loses 10 pounds, that's 80 pounds less pressure across their hip joint.
Wow.
And the knee is 4 to 6 times. And so, weight is certainly kind of the common thing here, where if we're making our joints, feel these extra forces, that adds up, and you get that cumulative effect that can cause damage. So ultimately, I would say is have a variety of interests, cross-train, don't run every day.
Good eating, good health, just all that just plays into it. Because I definitely want to keep doing this forever. When I started running, man, my knees would hurt, and it almost discouraged me to stop running until someone. I even bought these knee braces real tight. They have copper lining or something. I saw it on TV. And anyways, and they helped a little bit. But a friend of mine went on a run with me, and he's looking, he goes, "Why are you running in those shoes? Those are horrible running shoes." And I had these kind of Nikes, but there was no holes in them. And I grew up in a household, your shoes are fine until they get a hole in them, right? And that's not the case when it comes to running.
Just to clarify for our listeners, what he means by no holes in them, he means on the top or on the bottom. Meaning, there's whether you can see your toes or not is what he really means.
So, and me being a big guy, running I don't look like a runner. I look like a linebacker coming down the trail.
I was thinking more like a lineman.
As soon as I changed my shoes, I Googled a good pair of running shoes for heavy set, like big guys. I went out and bought them, put them on. I never wore my knee braces again. My knees feel terrific. And just changing that little thing up, I almost stopped running completely because my knees were hurting so bad, but it was just my shoes.
Yeah, I think that's a really important point, is that your form, whether it's in the gym or lifting or CrossFit or running, if you have good form, you're unlikely to have an overuse injury. If you have bad form, or you have a bad coach or a bad instructor, then that's going to spin you off into this land of injury after injury after injury. And again, I don't have any personal interest in shoes per se, but your shoes should be changed well before there's any sign that they're worn out.
Absolutely.
And if you go to any reputable shoe store or a running store, you know, the mileage on a shoe is actually a lot less than what you think.
Well, there was actually a website I found that you put in your weight and then the type of shoe, and it gives you a miles of how long your shoe should last. And then once it's done, that you shouldn't run in those shoes anymore. You
Absolutely.
can go mow the lawn in them or do whatever else you want in them, but you shouldn't be running in them. So once I found that, it said it's going to be like, I told the wife, said this is going to get expensive fast.
Yeah.
Especially with my weight, I better lose some weight.
Well, and that's what Chad, and you know, I've known Chad for quite some number of years, and he's always, you know, when I talk about what I can do to even enhance performance, right? I think as Americans, we're always looking for that silver bullet, like, hey, is there something, Chad, right? Can you get me some deer spray? Can you get me, you know, some silver bullet that's just going to make me play like I was young
I think
again?
everyone's looking for something like that.
Right, and really the simple answers are, in life, the simplest answers are usually the answers, right? So, you know, watch what you eat, be more active, get better sleep, better hydration, right? Take care of your body. And, you know, we just had, we had the lead singer for Hemlock on, and him and his wife lost over...
Between both of them, over 300 pounds.
Wow.
They went
That's
strict.
impressive.
Yeah, they went strict plant-based diet, and it changed their life.
Yeah, to see the before and after is amazing. Like you couldn't even recognize you out here to verify the picture. It's so different. And I think, so we're trying to implement some things like that even in our own household of better choices so that we can stay out of, you know, Dr. Chad's office is, besides counseling people to, you know, maybe improve their fitness and their diet, you talk about form. Do you ever counsel people? Is there ways that people can address those issues? If a you know, someone's a teen, maybe in high school or in college, do parents or coaches ever reach out to you to answer those questions?
Absolutely, and I think that's where we get both the physical therapists and the athletic trainers involved, because if somebody has a gait or a running abnormality, or the rotation of their feet, or how they're holding their hips, or a pitcher, how their arm mechanics are, those are all things that if they're bad, that's going to create a problem either soon, or it's going to create a problem when they turn 19 and they get to college or get drafted. Mm-hmm. And so the earlier that you can correct those disturbances and really improve how the body works and how it flows, the better you're going to be, and the less likely you are to have some type of catastrophic chronic overuse injury.
Absolutely. You know, having kids in sports, the number one thing is your parents. Parents is the biggest advocate of kids. And coaching baseball, the biggest problem is kids that pitch too much. And they're up on that mound day after day after day, throwing 80, 90 pitches. And it's constant with a 12-year-old kid. And there's many teams that have come out, you know, Little League organizations, some organizations do have limitations and rules against that. But there's a lot of club teams that there is no tournaments, that they have no regulations. And they can just pitch as much as they want. And I've had many parents come up to me, or I have quizzed them knowing that this kid pitches for another team, not just my team. first thing I always talk, like, did you guys do a tournament this weekend? Where's he at? What's going on? And even though he's probably my best pitcher on the team, I have to play him somewhere else because it's just not the right thing to do. So as parents, you know, if you're, I think that's really important. You're your child's advocate. You can stop them from overplaying or overdoing something like that.
But I think, unfortunately, I think you're probably still in the minority. I think a lot of teams and coaches still have the mindset of, that wasn't under my watch, so I'm not responsible for those pitches.
Mm-hmm.
And so he's staying in his pitch count for me, you know, full knowing that he pitched the day before for his club team. And that's why you're seeing, again, an epidemic of pitchers that are having the quote-unquote Tommy John surgery.
Way young.
Super young.
Mm-hmm.
Whenever this used to be a major league, it wasn't until you were a professional athlete that you would occasionally break down your elbow. But now, again, it has to do with a developing body, not ready for the rigors of how much speed and velocity and rotation and torque that they're generating, and they're creating a chronic injury.
Absolutely, and that's something you need to watch out for. I think in the last MLB draft, there was 4 pitchers that were drafted into the major leagues in the middle of Tommy John's healing process. Usually that's
So they weren't even throwing.
No, they weren't even throwing, but they were still drafted because they looked at the year that they were throwing, they did the surgery, and then it's usually a year down where before you slowly start building up your pitches and your speed and everything else, and they were still drafted. So a lot of these college kids are getting the surgery done, which I agree with you. I think that's way too young.
Yeah,
way too young.
Yeah, well, Chad, I really appreciate you coming on and giving us some real knowledge. I always thought, like in my head, you know, you talked about some of those professional athletes that go overseas, and Adam and I were talking about it earlier about, hey, why is this being done overseas? What do you see as the future for biologics? Like, what is there anything on the horizon that, you know, could give us a hope? And you know, now we're in these Rona days where there are no sports, where people are betting on ping pong, and you know, what do you see? You know, what do you see? You're so melded in to the whole sports process. What does our future look like?
So, you know, in every field, there's exciting things that come once in a blue moon. And in the mid-'80s, for sports medicine, it was the rise of arthroscopic surgery, or doing surgery through the camera. And that really revolutionized the field. And we kind of lived off that for the past 30 years. Well, biologics is that next super, super exciting field and niche for our ability to treat conditions that we've been treating for a long, long time, but doing so in a less invasive way, and in a lot of ways helping patients avoid surgery. And so that's what excites me, is seeing a person that we can help through a healing process and they never had to go under the knife. I think is, you know, if it was my own family member and that was an option and was something that really could work, I'd be really excited about that.
Well, and do you see that? So that will, you know, probably lower the cost, because if people aren't going under the knife, right, there's less liability. You know, I'm sure practitioners can lengthen out their careers doing treating clients, and so do you think that's going to help maybe elongate the counseling, elongate the careers as well?
I don't know about that. I think, you know, I'm still a surgeon. I love surgery. It's fun for me, and I like waking up in the morning and being able to go to the operating room.
Adam, will you note that he said it's fun cutting people up? Is what he said.
That's what I heard. I'm a little nervous.
Yeah, I am too.
I'm glad he didn't bring
I'm trying to see what
him.
he's carrying. If he has a couple extra scalpels, let's try this out.
But I think this is the next wave, and I'm excited for the literature and for the scientific support to prove what we're doing and the right places for it to be done, so that we can really validate with the patients that it is an effective treatment option. And hopefully in coming months and years, we'll start getting some insurance coverage so that it can be available to all.
That'd be fabulous.
Oh, absolutely.
What about, I mean, so, you know, Adam is a union a plumber, in one of our previous podcasts, he bragged about how great the medical is. He's like, yeah, we're bored. We just take them into the healthcare facility.
Yeah.
So I think it's great to hear that, I was reading today that NASA is actually coming out with a hyperdrive, and that's why I was kidding about the Star Trek. But so when I think about Star Trek, and you think about the onboard doctor, and they go right, and they go from being totally blasted to, oh, I'm feeling a little groggy, I can get up. And so that's what I'm hearing is some of these biologicals are getting closer to that, and that sounds way more appealing than having a huge stick put in your hip.
Oh yeah,
So-
absolutely. What do you recommend on supplements now to help out with joint pain or not pain, but just joint health?
So that's another great question. The supplement business is $1 billion business.
Yeah, and there's a lot of kind of crap out there.
There is a
But-
huge variability in the quality, and when you try to put these supplements head to head with other treatment options, they really give conflicting data. And full disclosure, a lot of the biologics that I've talked about have some conflicting data too, and so you have to really get into the weeds as to whether you're talking about glucosamine, chondroitin, or fish oil, or omega-3. While there is value in a lot of those, you don't want to overstate them. My party line to patients is, if you want to try them and it doesn't give you a lot of gastrointestinal upset and you can afford them, then they're very unlikely to hurt you. These are things that aren't dangerous enough that the FDA even approves.
Mhm.
But I think you want to pick and choose which natural options you're going to go for.
Kind of like trial and error almost. Something I've always said is like even getting healthy is a path of self-discovery. So you just kind of learn what is best for you.
Yeah, and I think, perfect example, my wife, she uses turmeric for her protein shake in the morning, and that's something that really she feels like provides an anti-inflammatory benefit and helps her joints. And so she stuck with it because that was something that she added to her regimen, and she saw a tangible benefit.
Yeah. Fantastic. Well, we really appreciate you coming on and giving us all this wonderful information, and I think it'll be also good for our listeners. We'll put any links or any email so they can contact you in the bio of this podcast, and you'll be able to.
Any ways that that our listeners may want to contact you, Chad, we'll put in the links, and then maybe we'll get a follow up. I think if we could hear more studies, maybe some more case studies on a follow up to this discussion, because my eyes have been opened. I really thought, like I said, of pro athletes, you hear, private planes, they're being flown into different countries, and they come back and they're able to play a full season, and so to me, when I think of those, I think I was like a kid, right? And pro athletes are all blinged out, and so it's interesting to hear that you're actually starting to do some of those treatments here for patients here domestically, that it's not like a faraway land of all these high-end doctors that are only treating like the rich and famous, and that people are finally getting options to procedures that have been very painful and that can be very intrusive. Like I said, having a father-in-law that just went through knee surgery, and you talked about it earlier, you talked about the value of an ACL in your stability and in your daily movements and your daily mobility. A lot of times I think we're thinking like we're in our mid-40s of a performance, right? Is this going to make me like LeBron? Am I going to be like the new LeBron on the court? And I think
Short answer is no.
I know, Chad is always so brash. I have these rose-colored glasses that, you know what, maybe with a little tweak, like with a little extra fish oil here, a little turmeric here, and a little bit of the good stuff right here. But to hear, I think a lot of your patients are probably older than us, and they're looking for, hey, I want to be able to get around the house easier and around the pickleball court more so than I'm not going to dunk the ball again.
Yeah, and I think that's a great point. You know, certainly we have we had that ourselves, where we get this realization that, hey, we shouldn't just reserve this for the high power professional athlete. There's a lot of regular people like me that have discomfort and have problems and have pain that we can help them in a lot of ways, can do it non-invasively without surgery. And that's really exciting for me.
And that's why we need the insurance companies to pick it up, because then it'll open up for many more people.
All right, so we'll have to
Until they
get-
start giving it away for free, and then we'll wait till then. But anyways, yeah, we appreciate it, and we appreciate everyone listening to the show. And always, however you listen to this show, on iTunes or Google Play or Spotify or Pandora, please leave a comment. It helps out the show, and it's an easier way for other people to find this show. The other way, if you feel uncomfortable about leaving a comment, you can always hit a link, copy the link, send us a text message. Say, hey, I just heard this fantastic show, a lot of good information. Share it with someone. Word of mouth is always a fantastic
Or
way.
if you feel uncomfortable about that, message us and we'll message them for you.
Absolutely, yeah. Give us all your friends' numbers. Just send your contact list over,
Yeah.
and we'll send the show out to everyone.
Or Twitter handle, or
Don't do that. I'm
Instagram
just joking.
handle.
I'm joking.
Or
Don't.
Pony Express.
There
Yeah.
we go. Some smoke signals.
Yeah.
But anyways, we appreciate everyone tuning in and listening to the show. Thank you so much, Chad, for coming on.
Thanks for having me, guys.
It's disappointing, Chad. Really thought you were going to say, yeah, you can come down to my office, we can get
Do
you
the
the good
shot.
stuff.
You'll have the lateral mobility of a
Yes!
22-year-old.
That's exactly what we need. So we've got some young bucks showing up on the underground
Underground league.
and we're just talking about today, our lateral movement, not there.
It goes away. Somewhere in the 26, 27-year-old